Satwa News, Accra.
Now, manager of the Western Regional Medical Stores, Oscar Emisa, says psychiatric drugs are in short supply in the Western region, making it difficult for mental health care delivery. Mr. Emisa blamed the region's supply of just 8 types of mental health drugs on government's overdependence on donor funding for the needed drugs. Concerns of mental health delivery in the Western region came to light during today's maiden Western Regional Annual Mental Health Performance Review meeting. A Deputy Director for Community Care at the Mental Health Authority, Priscilla Terrier, said mental illness is a key challenge as 10.1% of Ghana's population is affected. He therefore called on health practitioners to pay attention to the disease. The manager of the Western Regional Medical Stores, Oscar Emisa, however, revealed that the region is not getting adequate supply of mental health drugs.
Because of, I would say, maybe lack of funding, adequate funding in that area. Therefore, they are not able to purchase all our requirements. So we are doing it about 8. Even with the 8 key drugs, you don't get them always.
Meanwhile, the regional chief nursing officer, Beatrice Mukaya, says an improved mental health data from the grassroots can help in planning for mental health care.
The role of the mental health worker in improving mental health data cannot be overemphasized in mental health services delivery in the region. Mental health information or data are needed for planning and decision-making process. They permit cross-country and within-country comparisons, monitoring, evaluation and development of services. A strong case for making investments in mental health requires reliable data on use and benefit of services to evaluate cost effectiveness and cost benefits.
But the regional mental health coordinator, Charles Kwame Vigbado, believes that the establishment of regional mental health subcommittees will help to widen the coverage of mental health care in the region.
Looking at the number of facilities, it means there's a lot of deficit. So we should be considering how to augment those gaps or fill in those gaps. So I think the regional mental health subcommittee is a good thing because we are saying that they are to implement and execute policies. So which means that they are going to motivate and make sure that staffs are pushed in there to the smallest village that they can take care of mental health people with mental problem. So our focus is that we have a focus that as we move on, we'll be able to fill in those gaps.
A report by Agyei Annim from Takoradi. Now, still on health, the increase in the number of pneumococcal meningitis cases